You are listening to Radio Bilingüe on WBFO FM HD3 Buffalo, powered by Sin Fronteras Western New York and presented by Batavia Downs Gaming and Hotel. More information at bataviadownsgaming.com. Sin Fronteras Western New York, Buffalo's media platform for Western New York Hispanics,
producing bicultural content that informs, entertains, and inspires the forward thinking.
Sin Fronteras Western New York, delivering bilingual stories,
hot topic conversations,
and the voices from our Latino community.
Sin Fronteras Western New York,
la única producción contemporánea en español
y en inglés en la ciudad de Buffalo. Sin Fronteras Western New York,
your connection to cultural ties in Latin America
and hyperlocal news in the Western New York area.
Sin Fronteras Western New York es para ti.
Hola, Dinorah. We're
Hello,
here again on another episode of Sin Fronteras Western New York here on WBFO 88.7 HD3. How you doing, Dinorah?
I'm all right. I'm excited for today.
We got to be excited. We got a very special guest with us today
Yes,
from
we
a
do.
very special organization that does a lot of good things for the community, and we're very pleased and humbled and honored to have Valerie Cruz here from the Buffalo Prenatal-Perinatal Network. She's a program supervisor, and just for our audience, the Buffalo Prenatal-Perinatal Network empowers women, fathers, and families to improve their family health and well-being through education, support, advocacy, and connection to resources and services in Western New York. Their work is dedicated to honoring the dignity and capacity of individuals and communities while promoting healthy equity. Welcome to the show, Valerie Cruz.
Thank you for having me.
That's great. Good to see you, and great to have you here on Sin Fronteras, Western New York, a show that we have every Saturday at 10 a.m. here in the Western New York region, Southern Ontario, through WBFO 88.7 HD3. And I got also a special host here with me today.
Yes, I'm just a special guest. Usually we have another host, but I'm Dinorah Baines. I'm also board director for the Hispanic Heritage Council, and I'm happy to join Kaz to interview you and learn more about you and the Buffalo Prenatal-Perinatal Network. So, Valerie, tell me a little bit about yourself.
So, well, I came to Buffalo, like, I think it was 2017. After the Hurricane Maria, a lot happened in my personal life, and I was just looking for, a change. And I ended up in Buffalo. I started working on Buffalo Prenatal 3 years ago, almost 4. And it's huge difference. In Puerto Rico, I'm a social worker, so I used to work with the project population in a program called Vivienda en Acción. So it was a program that we help children from 6 to 18 to get out of the way of streets, drugs, and everything like that, with education, support. And coming here and find, I was a first-time mom. When I started working in Buffalo Prenatal, my baby was 2. So it was a whole new world that opened for me. And I was like, this is like, when I started working there, I'm like, oh my gosh, this agency do so much. And I feel like if I have this information prior I have my baby, everything will be so different, So I think that was one of the reasons that when I ended up at Buffalo Prenatal.
Very interesting, Valerie. But what university did you go to in Puerto Rico?
So I started at the Universidad de Puerto Rico, la UPR, en Humacao. And then I switched to the Inter-American University in Fajardo, and I finished my bachelor degree in social worker. I found it the other day, and I was telling my fiance, look, I graduated magna cum laude, okay?
Pero ¿de qué pueblo tú eres?
Yo soy de Ceiba.
De Ceiba.
Nací en Humacao. I was raised in Humacao, but then when my parents, they got divorced, so my mom moved to Ceiba. So I spent like my rest of my life over there.
Oh, that's
And
great.
I like to go and visit. I think if I have the opportunity, every time that I can, I just go. I miss the beach.
Do you?
Oh.
You miss the beach?
The beach over there is different. When you go to the island, that water is different.
Yes.
I don't go to the beach a lot in Buffalo, but if I'm in Puerto Rico or the Bahamas, I'm going to the beach.
Definitely. It hits differently. I remember my fiance, I was, you got sick, homesick sometimes. He's like, yo, there's a beach. And when he took me, I think it was Angola.
Angola,
Oh, yes.
yeah.
I was
Angola.
like, what is this? This is a real beach. And he's like, yeah. I'm like, oh, it looks different.
Qué bien, qué bien. Valerie, you had mentioned if you knew now what you knew then, or if you knew then what you know now with prenatal, it would have been different because now, you have a child.
Yes.
And you're going to have more children.
2 more coming. Oh, my God.
2 more coming.
I'm excited and nervous.
Don't get nervous. Don't get nervous. But, along those lines, Valerie, can you share what inspired you to join the Buffalo Prenatal-Perinatal Network?
Yes.
And what brought you to focus on maternal and family health?
So when I was pregnant with my daughter, I have prenatal depression. So I was crying the whole time. I remember my mom saying, like, that baby's going to cry a lot. And it's true, though. She cried for everything now. But I didn't know what to do. I was stuck in the house. I didn't know nobody. So I feel like in our program, they offer so much. Like they have the empowerment groups, we have support group, we are a baby cafe. So they have the opportunity to the clients to, go out and at least meet somebody or us at the office. So that's something that I didn't have. So when I look what the agency offers and all the stuff that they do for the community, I was like, I need to apply. I was scared at first because I think when you're a perfectionist like me, I feel like I have a language barrier and I was a little bit hesitant to apply. But the position requires Spanish speaking, for the Spanish speaking population. So I'm like, okay, I have to speak most of the time in Spanish. So I'm just going to try. And I'm like, I'm not regretting it at all. I really loved it. And I feel like my English has improved a little bit since I started working here.
So it's a cultural attribute.
Yeah.
And it's bilingual support groups and services that
Yes, we translate.
Translate.
And I think you bring a lot with being able to speak Spanish. You're able to help out and reach to a population that they definitely want to target. So how does the Buffalo Prenatal-Perinatal Network's mission to empower families align with your personal vision of fostering healthier communities?
So first, we like to focus on, every time that we found a client, we do an assessment. So it's like, I feel like the program fit everybody's needs. And then we go through education, support, advocacy, connection with resources in the community that they might not know. If they need diapers, we can do a referral. If they need clothes, we can link them with services in the community that they can help with clothes and stuff like that. So I feel like it's more case-to-case basis because, like, right now, I'm seeing a lot of more clients that need help with housing that it was when I started working. So you can see with times and that we're living, everything is changes a little bit. So now I feel like it's more a necessity to not even housing per se, like I think affordable and accessible housing. So I think everything is gonna fluctuate with time, but definitely everything goes case by case. Even though we offer a lot, probably this client only need like the support, or this other client needs everything. So we do, we're case management, like we do case management. So I feel like that's what, and it aligns with me, because I always tell the girls, even though sometimes they, I don't know how to say it, like, yo creo en Dios.
Yes.
Qué bien.
So I feel like sometimes that's our work in this land, la tierra, you know, help. So I really fill me up helping other people. So I think this is one of my values that I bring to the agency. Like, I really enjoy helping people.
Yeah.
So the Prenatal-Perinatal Network story is your story. You made it personal.
Yes.
Yeah.
Where are you located?
So we are located on 703 Washington Street.
Okay, so folks that were looking for support or
Yeah, they can
services.
call us
Okay.
and our agency, and we can send a assessment worker over there to see what they need, and they, you know, because our so let me just explain a little bit. So Buffalo Prenatal is we have 5 programs, and each program have their, you know, their not restrictions but requirements.
Yeah.
So the one that I work is the Community Health Worker Program, and we are funded by New York State of Health. So New York State of Health, they want to lower the maternity morbidity and mortality rates that, you know, New York State have in Erie County. So they focus on a couple zip codes. So like the west side and the east side of Buffalo. So the majority of the clients that we serve are brown and black communities and Hispanics, because that are the ones, they are in a zip codes that the, you know, the state.
Yeah.
But other programs like the Healthy Families, they can go, I think they have like a more ratio. They can go more out, I think like a Warner and another, you know, closer areas to Buffalo. But we just serve these, you know, these zip codes per se.
Yeah.
But definitely they can call us and we can just look if they qualify and be more than happy. Well, not now, but
What's the phone number to
yes.
call?
So the phone number of the agency is 716-884-6711. 716-884-6711. And they can ask for me, if I'm still there, or for Maikia Gibson. She is the other one, supervisor, that do the same thing as me.
And the reason you say, as for me, if I'm still there, is because you're going to be going on maternity leave. Ain't that right? But you'll be coming back.
Yes, I'm coming back, but don't tell me until I'm coming back.
So for people who may not be familiar with the terminology, what is prenatal and what is perinatal?
Prenatal is when you're pregnant and you have the baby, and perinatal is
After you have the baby.
So there's many wraparound services and a lot of services that cross over one another. Ain't that right? With the agency.
Yes, like for example, we are the Community Health Worker Program, and we have, like I told before, the 5 other programs that are within our program is the Healthy Families of Western New York. The Healthy Families program is like, when I started working, I think it was a lot of information, so I divided on my head like this. So the Healthy Families, they're like more a parenting program. Their mission is to lower the child abuse and neglect. So a lot of the referral that they receive are from CPS or other agencies. Definitely they're gonna help you with the needs that you have at the moment, but they're like sit down with you, they help you with parenting information, classes and everything.
So that specific program, that can be for men and women? Or is that just for, like, can fathers take part in it, mothers?
We have a fatherhood program.
Okay.
So they call the Fatherhood Initiative.
Mm-hmm.
So that program is help, fathers,
Mm-hmm.
and they offer. The thing that I like the most is that they offer a lot of like little programs within the program.
Mm-hmm.
So they offer classes. They have this nurturing father program. I think it's like 9 weeks or 13 weeks. I'm not sure. I'm sorry. And they're trying to start to make it in Spanish as well, because right now they only have it in English, but sometimes I translate and sometimes other girls translate, but they wanted to do like a Spanish speaking program too. So they mentoring the father, they sit one-on-one with the father, and if they need assistance with getting a job or stuff like that, they can help them. They also have this another kind of little programs. My favorite was Dads Do Hair.
Dads Do Hair.
Yes.
Oh, tell us about that.
Yeah, so that one, they invite the fathers, they have daughters, and they invite someone, and that person teach them how to do the daughter's hair.
Yeah.
Oh, yeah.
I
So
love
that was
that.
very interesting, seeing them like, trying to do the ponytails, and they even tricks and stuff. So that was one of my favorites. The other program that we have is Go Buffalo Mom. Go Buffalo Mom is a program for transportation. Like if you're pregnant and you are at high risk, we can help you to access to bus passes, or maybe you can qualify even for a taxi.
Mm-hmm.
So you don't have no excuse to go to your prenatal appointments.
Mm-hmm.
And that can stay with you, I think, for a year. So after you have the baby, you can still use it for a year.
And I think that's important, especially in this Buffalo winter, trying to take transportation or find transportation in the cold.
Mm-hmm.
Wow.
So that's one of the programs that we utilize. So as a community health worker, sometimes I say, I'm assessing the family and the father needs assistance, so I can make a referral. Hey, I think this program will benefit you. And we do a referral over there. And sometimes when they have like a lot of transportation issues or they have a lot of appointments, so we refer to Go Buffalo Mom, and we refer in between each other too.
Mm-hmm.
So it's good because maybe you are in Buffalo Prenatal, but you can be participating in all the programs or just one.
Incredible support. As a program supervisor, how do you approach empowering women, fathers, and families to take charge of their health and well-being?
So when we were talking prior, so now we have another one, but I was the only one who do the assessment. So when somebody, is referred to our program or called that they need assistance, I go to the house, sit down with them, and we complete a questionnaire to see what they need. So right there, I can say, okay, so the goals right now is going to be like, for example, if she don't have prenatal care, so establish prenatal care, establish medical and all that stuff, and then we continue like that. So we just focus on, I always say primary goals, secondary goals.
Can you tell us more about the specific roles the Buffalo Prenatal-Perinatal Network plays in promoting health equity, particularly within the Hispanic and African American communities?
So today, for example, we did at the office a conference with because this is I think October is the month of blood pressure, something with blood pressure. So we did a conference, and we launched a program that we are helping moms to monitoring the blood pressure.
Yeah.
And because one of the not sickness but things that you can develop during the pregnancy is preeclampsia.
Yes.
And preeclampsia, it doesn't show no signs. And the only thing that you can find out that you have it is by taking your blood pressure. So that's one of the things that we try, and we focus a lot on mental health. We do conference to help the clients to be more aware of the stuff that are in the community. And yep, I think yes. Maybe it's more.
Yeah, no, I think it was National Women's Blood Pressure Awareness Week in October. But you know what's crazy is that once you're pregnant or thinking about pregnancy, you start to learn about all these things that can happen. The preeclampsia, gout, gingivitis, even women getting gingivitis. And then or what I saw on online, there's a lady that makes a list, and she'll put a list of reasons why I don't want kids. And then when someone mentions their experience of pregnancy, and women will lose their teeth, I've seen, because of maybe calcium, and then she'll add that to the list. Preeclampsia, she'll go and add that to the list. But it's you start to learn the impact that just having a child and getting pregnant has on the female body that people don't know about.
Yes, and definitely one is simple. Is by start taking your prenatal vitamins.
Yeah.
Some people are like, oh, they're so big, I don't want to swallow them. But you don't. Your body only can produce so much. So with prenatal vitamins and folic acid is very important. So that's another thing that I didn't know, and I learned when I started working here, that the Hispanics population have a higher risk of develop babies with spina bifida.
Oh.
So, and only by taking folic acid when you want to get pregnant, or you found out you're pregnant, you start taking folic acid. That pill only can help you, so your baby doesn't, come out with.
Wow.
spina bifida,
So listeners, you're trying to get pregnant, start taking your folic acid.
Definitely. And I was like, wow. And I wish I had the flyer, but the flyer, it says Latinas. And I'm like, ooh, Latinas. So when I started reading it, and it said it we have a higher risk.
Yeah.
Just our
Genetics. Yeah.
Valerie, you mentioned these community engagement workshops and conferences. How do you get the word out to the community about these programs that are happening so that the community is aware and they attend these valuable programs and conferences? How do you get the word out?
So, we do a lot. We try to stay relevant, coming in the radio, the news, but our program manager, she said that we need to go door to door.
Okay, so you have
we
outreach.
do outreach.
Okay.
So door to door, I feel like it's one of the most important
I
things
agree.
that we
That
do.
personal contact.
Yeah.
Because me, I think last week we did one on Saturday. So we grab a zip code in our area, and we just go if somebody pregnant, that they don't have prenatal care, they need assistance, and stuff like that. For me, that's one most effective. And because we find people in the community that maybe doesn't even know. They don't have a Facebook.
Yeah.
Right.
They don't have our page. Probably they don't see the news.
Yeah.
So going door to door, we also receive a lot of referrals from clinics. DSS refer us. WIC refer us, and a lot of other, organizations send us referrals. So that's one of the enrollment process too. But I feel like outreach, being in the community and door to door is one of the most effective.
I agree, because even if they had Facebook, the algorithm, it'll show you things that you are interested in and want to see. And if you're not familiar about this organization or the services, then how can it know that you're interested in seeing this? So then how will you then get the post that they're sharing, or it will send to you? The organization can post on Facebook and I could never see it. So that's the door-to-door is important, especially even when you talked about the services that they provide, like transportation. If I don't have transportation to go places and stuff, then how would I, even know to go there and learn about it? So I think that's great that they still do door-to-door.
Yes, our boss, we call her boss lady, Marixa, shout out. She's like, we have to do door-to-door. We have to do door-to-door. And she has some stories. Like, I think it was 6 years ago they was doing door-to-door. And they found out a family. And I think the girl was 6 months pregnant. And she was living on the floor. She didn't have a bed. So they enrolled her on the program. They help her with donations, provide a bed so she can, and she have a healthy baby at the end.
And this was just by going door to door?
Life-changing experience.
Yeah. So that, this conversation makes me think about the next question we want to ask you. So how does the Buffalo Prenatal Network work to overcome barriers that women and families in Buffalo face when accessing healthcare services, especially in underserved population? So this could be a lot of things, like you've talked about the transportation, even people who may not have the technology or the language or even insurance. Don't know about it. So what are some of the things?
So I can tell, like, for me, that I work with the Hispanic population, I feel like a lot of language barrier. Like, they're afraid to go places because they don't know if somebody is going to speak Spanish over there, or even though just to call and make the appointments. So we help a lot with advocacy to help them, no, come on, let's go. If they don't offer translation, we can, support you. The transportation is a big factor too, but that one is a little bit tricky because they need to be already enrolled in the healthcare system so they can apply for the Medicaid transportation. But other things that I'm seeing too is sometimes the client, they don't feel heard. Like, I telling you I have this pain, and the doctor is like, yeah, it's normal. I'm like, no, I'm having pain. So having extra support, I feel like sometimes the clients feel like, okay, she's with me and she's going to make sure that she understands that I'm having this pain. So I think that was the majority of what we do sometimes, like just be with them and help them. Because sometimes, even for me, sometimes now that I'm pregnant, I'm going to my prenatals, I encounter myself advocating for me. I'm like, hey, I'm 28 weeks. What happened with my glucose test? I need to be on point too. And I know because I work here, but it's somebody that doesn't know, like they need that, extra.
That's very important. And, we're speaking with Valerie Cruz, Program Supervisor, Buffalo Prenatal-Perinatal Network, our guest of today here on Sin Fronteras, Western New York, WBFO 88.7 HD3. Valerie, what strategies have been most effective in reaching out to the families that need support?
So how we would say before, outreach, going to the clinics, door to door, be present in the community. And I feel like sometimes networking with other agencies too, because maybe they don't offer that services, but they were like, oh, but I remember this agency that they kind of help you with that, and just they can make a referral to us.
So the Buffalo Prenatal-Perinatal Network is pretty much engaged in community activities, events. You do tabling as well.
Yep.
And a lot of information sharing. So you're basically present in the community.
Yep. We were, I think it was like 2 weeks ago or 3 weeks. I'm not sure. I'm like so bad with timing in my brain in this pregnancy. Sorry. But we were at the Epic. They have an activity, a toddler expo, we were there. I think they have these community resource fairs.
Okay.
One of our staff, she's always go over there. The other program, they always do outreach too. Sometimes we even go to schools if they have, and we can table there. Like, we do a lot of outreach to try to promote our program.
You mentioned schools. Do you have a program that you do in the schools, high schools?
No, but
No.
we receive a couple referrals from social workers from school that girls that are in high school or that are pregnant. I think in the last time talking with the other supervisor, she told me like the youngest one that she worked with, it was like 13. And the older one, it was like 64.
Okay.
That it was, in the program. So the range of age varies. But because we have these pregnant teen moms, so sometimes we just go to the schools and reach out. And other programs too, like the fatherhood, they trying to engage fathers at the school because they don't have an age limit or nothing.
Okay.
Our program have age limits. So.
What are some of the health disparities in maternal and prenatal care persist in marginalized communities?
So I feel preeclampsia is one. I told the majority of the girls that they don't. Today we were talking between each other, and one of the girls was telling her story about how she found out she was having preeclampsia, and she was totally fine. She's like, well, why are you telling me that I have preeclampsia? Like, I feel fine. And the doctor said, hey, no, you have, come to Madison get you, or we're going to the hospital. So sometimes they doesn't show symptoms. So with education, so, that the client will know that could happen to me. So there be like more awareness. That was one. And another one that we work a lot is with gestational diabetes.
Is there something that like women of color that, like how you were saying, spinal bifida for Latinas? Is there something also that as Latinas or even Black and brown women should be aware of?
So the Black and brown community, they're like more. If you look the rates of the maternal mortality and morbidity, the Black and sadly, the Black and brown community, they have more like morbidity and death during or after birth. I'm sorry. And I think sometimes it's the hemorrhage.
Yes, or hemorrhage. Hemorrhage.
Yes. High blood pressure and all that stuff. There is, I think it's in Hulu. It's like a nice documentary about it. I don't remember the name, but they talk about 2 cases of 2 brown, Black and brown women that die, and the complications that they have, how the doctors. And the sad thing is, like, the majority of that statistic, it could be preventable.
And how can that be preventable?
If the doctors listen.
Yeah.
If the doctor listens, that's, it's like preventable. Like, they do a blood work, this girl is hemorrhaging, and they didn't, they give her a pill, so they didn't follow up. They don't listen. They think they can tolerate more pain or stuff like that. So know your body, and when you know that something is wrong, be able to advocate and say, hey, I know if something is wrong. Maybe my blood pressure. Because I am Hispanic, I'm more, I have more propense. That's the word. I'm sorry. Like, I have more risk. To have this condition. So can I just start looking into it before it happens?
Yeah. So. I know, like you were saying that the Buffalo is there a short version to say the Buffalo Prenatal-Perinatal Network?
We say BPPN.
BPPN.
Yes,
So you were saying that BPPN, there's advocates, right?
So we are community health workers. So we go, we visit the clients, and if we see the needs, we go with the client. I've been to the clinics with clients sometimes and other workers too, if we feel like, they need the extra support.
Yeah, the reason why I brought that up, because you're saying, you have to advocate for yourself. So for me, when it comes to my family and they got medical appointments, I'm like, okay, what questions are you gonna ask? I'm their advocate, and I'm like, well, did they find out this? Okay, well, after your appointment, give me an overview. But I ended up in the hospital once, and I was a big baby. I could not advocate for myself, but luckily I had my husband there, who then was able to help, advocate for me and stuff. But when it comes to my family, I'm a bulldog. But when it comes to myself in a hospital setting, I can't imagine if I didn't have family there to help, to advocate for me, to know, like, okay, ask the right questions, or because it's like you're in a fog when you're in the hospital.
And that's one. And imagine, because there is a lot of topics that we can add to that. Like, you are pregnant. You are having a lot of change on your hormones. Your body's trying to create this life, but you don't have stable housing. You have other kids to take care of. You don't know what is going to be their next meal. So there is a lot of stress factors that they can add up.
Yeah.
And
just compounds.
And what do you think is more important for a mom? Like, find the next meal for my children, or go to a doctor to take care of this baby that are coming.
Gosh.
So there's a lot of stuff that we can, talk about.
Going back to the fatherhood program, okay? And you have these programs and support systems for the males, okay? Are the caseworkers male or female?
So they don't go, the fatherhood program, they don't go to the houses like our program.
Okay.
They do like the Zoom meetings, and they do the classes virtually and sometimes in person, but they meet in a certain place. But the person that provide the classes, Mr. Terry and Michael, so they're both males.
So they're both males.
Yes.
There's more reception there.
Yes.
There was recently a conference, a fatherhood in boys, men of color conference. So that was, the BPPN, they partnered with Breaking Barriers, and this was part of the My Brother's Keeper initiative. So tell us about that conference.
So I wasn't able to go, but they do that. I think that was the sixth conference that they do annually, and they just talk a little bit more about the stuff that they're doing in the community and empowering the fathers. When I went, I think last year, it was great. The speakers that they have, you go out of there like so empowered to help the community and, to be more present for your children and stuff. And that's why they look like, to help strengthen the bond with dads and their children.
Yeah. Hispanic men and men of color tend to be very reserved. Do you find that a lot, or?
Well, I don't work with the program per se, but I feel it in the way that I make a lot of referrals, and then when they call, they don't answer the phone. Yeah. So I'm like, they're not being, a little bit not compliant. Yeah. And I feel like maybe it's the pride. And one time when
machismo.
Yes. It's the machismo. And one time when I translate for the class, they ask questions in Coqui, nobody was talking. And I'm like, come on, let's do this.
Yeah.
No, just, they were like, there listening.
Why do you think these conversations that are happening in this event and these other this program, why do you think that's so important in our community and for new fathers?
First, even you're a father or a mother, like nobody comes with the baby doesn't come out with a book with instructions. So I feeling like you're not alone, like you have somebody that you can relate to. And sometimes even, I'm just gonna throw it out there, the shame. Because some people feel like a little bit of shame. So like, I feel this way, why I cannot connect with my baby, why I feel so overwhelmed. And they knowing other persons that probably are, having the same questions, and help you like, okay, well, all right, now I get it. Everybody feels that way. I'm not the only one. And that can help your confidence too.
You're right. We have a special guest here today for our audience, Valerie Cruz, a program supervisor from the Buffalo Prenatal-Perinatal Network. Once again, Valerie, tell us where you're located and give us the phone number for our audience to contact if they need any support.
Yes, they can definitely can call to our office, 716-884-6711, 716-884-6711, and we are located at 703 Washington Street.
Looking ahead, for the Buffalo Prenatal-Perinatal Network in the next 5 years, what do you see? What do you see as far as what's the long-term impact that you, as a supervisor, a program supervisor, hope to achieve in improving the family and health and well-being and health equity of the community?
So I'm going to take the CEO words. She's like, I want to get into housing.
Who's the CEO?
Luann Brown.
Luann Brown.
So she was like, I wanted to get into housing because I feel like that's one of the most things that I'm seeing, the clients struggle with. So if we can have a place, so we can just put our clients or help them get into housing, that's going to be, and I know that she's working so hard to make that.
That's great.
But definitely that our program is more, everybody knows about it, and we can continue with our, we are a nonprofit agency, so definitely we need support.
Absolutely.
And our donors and more grants coming so we can continue this work.
And continue the housing portion, to meet the needs of the community residents. Isn't that right?
Yeah. So sometimes we have clients like now. For example, we have a client that I know that one of my the people that are the workers that I supervise is working with. She is now she have the baby, but she was like right there to have the baby. She don't have no place to live. She was living with a family member. The family member got in trouble because she had her there. So we're trying to find apply everywhere to see where we can place her, and it's so hard to find, affordable housing.
Yeah.
I really, Dinorah, I really appreciate this interview and everything that the Buffalo Prenatal-Perinatal Network is doing for our community. There's a lot of passion here.
Yeah.
And a lot of services and programs that are really affecting many lives in our community to the positive.
Yeah.
And I want to let you know, Valerie, that Sin Fronteras, Western New York, the Hispanic Heritage Council, we're here to help you promote your mission and your services to the community. So send us the information so that we can share it with the community at large and promote the beautiful and wonderful things that your agency is doing for Western New York.
No, definitely. And when you guys open, I know that you guys
The
are going to
Institute.
open. I want a spot to do outreach over
There
there.
you go.
That's
There
it.
you go.
Done.
Well, hey, take
Done.
notes. Take
Yeah.
notes, Dinorah.
So, I want a spot over there so we can do outreach.
Absolutely.
Yeah, we're having a good conversation here on Sin Fronteras, Western New York, WBFO 88.7 HD3 with Valerie Cruz, Program Supervisor of Buffalo Prenatal-Perinatal Network. Valerie, thank you very much for being with us this morning.
Thank you for having me.
And
I'm very excited.
Yeah.
and we'd like to invite you again once you come back from your maternal leave.
Definitely. I would love to. Maybe my brain was working better.
Oh no, you were fine. Yeah.
But definitely, and I always want to tell the community, like in one of the not the beliefs that we have is like if you call us, like if you speak Spanish, you're gonna get a Spanish speaking worker. If you're probably one of the girls we are from the community too.
That's right.
Like we are here, we know the struggles, and we are more than willing to help. And your worker is gonna look like you, is gonna talk like you, and is gonna help you. Because sometimes when we just like me, I always put my personal experience in the game, and I tell all the clients the same every time that I open them. When I came here, I don't even know anything. Only where it was the supermarket and, the stuff like that. But with time, you start knowing the community and you want to give it back. So we always encourage our clients, if you know somebody that is struggling too, come on, give us the information so we can help them too. So the clients become advocates.
That's
too.
good. You put a lot of passion and a lot of commitment and dedication to your work, and you can see it. And I'm pretty sure that your colleagues and your partners in your agency feel the same way you do.
Yes.
Yeah.
You have
and-
another question, Dinorah?
Well, I want to make sure that we talked about all the programs because you had mentioned the 2 programs, and were there other ones that you want to make sure to mention today?
Yes, so I think I talk a little bit about them. It was the Healthy Families. That was the one who you offered, the parenting program. They help with the necessities too, but they're a little bit more focusing on parenting. We are the Community Health Worker Program. We offer help with link with other services. If they don't have Medicaid or they don't have insurance, we can help you, securing a primary care, make sure that the babies goes to their appointments. We have support groups. We have a baby cafe. We have the baby cafe is open to the public. It's every first Wednesday and Thursday of the month. In our office, we have a licensed lactation consultant there. If you are breastfeeding, if you have trouble, you can go there. We have our empowerment group. That is for women that have like postpartum depression or depression. We have a licensed clinical counselor that meet with them and help them too over there. I think that one is once a month. And then we start working with a community advisory board. So it's clients that graduate from the program. They get together every month to see. They even put a name of the group. So I think they put is Courageous Advocates Breaking Boundaries or Barriers.
Barriers, yeah.
So they put their own name. They went to the community too, and then trying to learn. They have the opportunity, and we send them to one of the local universities here. They got trained how to be a CHW. They give it the break to do an internship in our office.
That's great.
Wow.
So it was a paid one. So it was like, I feel like there's a lot of things that we can, we've been doing.
And for our male listeners, don't forget about
Yes,
the fatherhood.
Yes.
The fatherhood program.
Initiative.
Yeah.
And we have the Go Buffalo Mall.
The Go Buffalo
So
Mall.
if you go to our website, it's BPPN.org, you can see all the stuff that we can do and explain every programs to individually, and you can make a referral in our page as well.
That's great.
Because sometimes I know that people don't feel comfortable calling, so they can go online, www.bppn.org, and they can make a referral from themselves, or if they know a family member that, will need that assistance.
And you're located where again?
703 Washington Street.
And your phone number?
I was going to say 787. Look at me. Puerto Rico area
Puerto
code.
Rico.
Sorry. 716-884-6711.
You mentioned your husband. ¿Es puertorriqueño?
So he is Puerto Rican. I'm not gonna
De aquí o de allá.
If he heard me on I'm gonna sleep outside. But I always say he's fake Puerto Rican because he was born here.
Oh, come on.
So he always got so pissed about that. But no, he is from here. He was born and raised here.
Here in Buffalo?
Buffalo.
And you met him here?
Yes, it's a funny story.
So he's a New Yorican.
Yes.
Buffalo Rican.
Buffalo Rican.
Well, New York State.
Well, yes. So now that I have, because that was our joke when I met him, I'm like, you're a fake Puerto Rican. I'm Puerto Rican. I'm from the island.
Habla español.
He always said that his Spanish is un poco feo, but our dynamic is like he always talked to me in English and I always talk to him in Spanish.
Oh, that's great.
So our daughter is so funny because our daughter knows that. And sometimes he starts speaking Spanish and she's like, shh, English. She knows. She's like, Daddy is English and Mommy is in Spanish. And sometimes she gets tired of me. She's like, Mommy, can you start talking English?
Oh, but she knows Spanish and English.
She knows, but she's a little bit lazy. She don't like to talk Spanish. She understands me, though, but she don't like to talk Spanish.
So the cultural experience in the household is very important.
Yes. And it's so different. Like, I learned so much when, and it's so funny because for me, the first cultural shock was Christmas. In Puerto Rico, we are outside. We are outside. We go parrandas. We go in house to house. The titi have the sopón. The other one have food waiting for us. And here with the snow, Puerto
you're
Rico
not going
is
anywhere
green the whole year. And coming here, I think I cried so much the first New Year's that I spent here in Buffalo that my nose clogged and I couldn't even breathe. Because imagine me, 28 years, I don't want to say my age, but 28 years living in Puerto Rico. Being outside all the time, watching the fireworks, being with the family, and now here is just watching the TV and so that was for me was a big cultural shock. But now with time, I learned.
You're adapting.
I trying to and I trying to see the beauty in the snow and how dress for the occasion and the weather. But it was, and even for us, sometimes when I get mad, I cannot speak English. Like, I'm mad, I'm not. It doesn't come out. And sometimes he's like, whoa, give me all that in English. So I'm like, so I have to breathe and, try. But yeah, and I feel like a lot of, modern family now, they have the different cultures. Maybe you are like me. His family is from Puerto Rico, but he was born and raised here, so he have culture. It's different. It's different, the food and everything.
Yeah. But now for the paranda, the Hispanic Heritage Council, we have one in December.
Yes, I saw it.
So make sure, we'll be posting that on when the date is, and I want to see you there so you could get some Puerto Rico.
Maybe next year, because the babies are going to be very big. But yes, I saw them online. And you know what? Now that I'm here, I have the opportunity, and I can say it. So I went to the It was
Tragedias.
last year.
El
It
Día
was
de los
last year.
Tragedias.
No, it was the Hispanic Council breakfast
Yes.
Okay.
Yep.
that you guys do. So there I see the flyer for Fabiola Mendez.
Okay. Did you go to the
So
concert?
I'm like, I need to go because my family on my dad's side, they're all musicians.
Okay.
They're all musicians. The only one that don't know how to play something is me. But my dad family, everyone know how to do something. So I remember I went, it was so full when I get there, but I'm like, I need to be there. I need to be there. I love the Cuatro so much.
We gotta
So
bring her
when
back.
Yeah, we
I
gotta bring her
know.
back, yeah.
When she start doing, I think it was the Aguinaldo.
Yeah.
Something, I start crying.
Oh my God, we gotta bring her back.
Yeah.
I start
Huh?
crying, and I'm like, oh my God, that remind me so much home. My daughter, she loves the music.
That's
too.
great.
Like I always try to, and here and now that, like, when you start learning about the community, you start learning about places. So I took her to a place that they show how to do bomba.
That's great.
Yes.
And the other place, one time they do something with the Tainos.
Yeah.
So I took her over there. They painted her face. Like she's getting more involved in
That's
our
great.
culture.
Yeah.
And that's what I always tell my fiance. And I'm happy that he is on board with that.
That's
that
great.
even though we are raising our daughter here, I want her to know. Like if
Her
you ask
roots.
her where she's from,
That's right.
she said Puerto Rico.
Puerto
Yeah.
Rico.
Even though she was not born there.
But that's the same thing with your husband. I think we're very proud because I wasn't born in Puerto Rico, but you can't tell me I'm Puerto Rican through and through. And then
now, I changed my opinion because
Yeah.
now I have a daughter. But that was
Yeah.
our joke when we first met. I'm like, no, but now that don't tell me that my daughter is not Puerto Rican.
yeah, my husband, he's not Puerto Rican. But when I say, oh, I'm Puerto Rican, and I tell other people, oh, what are you? I'm Puerto Rican. He's like, not really. You weren't born there. No, don't. I am Puerto Rican 100%.
Puerto Rican and proud.
Yeah.
Huh?
And I feel like if you're still connected, like if you go, like I
Yeah.
try to take my daughter at least once a year. At least once a year, so she have the interaction, that she go to the beach, that she sees everything, like she see my family, she interacted with them. And last time I took her for her birthday, and she was so happy. She's like, Mommy, I don't want to leave because my mom have this big yard that here we don't have in the city. We don't have that kind of
That's
pleasure. But interacting with other family members and knowing the culture, I think it's a big plus. And
Yeah.
I feel like that's what we have to do. Like always trying to keep our roots alive and make sure that everybody knows, even though we are here, but our hearts still
Yes.
in Puerto Rico.
That's the mission of the Hispanic Heritage Council.
Yeah.
Keep our roots alive and keep them, part of our life here. Valerie, thank you very much for being with us today. It was a wonderful interview, wasn't it,
Yes, it
Dinorah?
was very informative.
Very informative. I learned a lot today.
I did too.
You are listening to Radio Bilingüe on WBFO FM HD3 Buffalo, powered by Sin Fronteras Western New York and presented by Batavia Downs Gaming and Hotel. More information at bataviadownsgaming.com.